Common symptoms of borderline personality disorder, BPD, difficulty controlling anger. One of the hallmark symptoms of borderline personality disorder, BPD, is difficulty controlling anger. Individuals with BPD often experience intense, frequent anger, which can be triggered by real or perceived slights, frustrations, or feelings of rejection. The anger can be disproportionate to the situation and may lead to impulsive outbursts, verbal aggression, or even physical aggression. These emotional responses can cause significant challenges in relationships, work environments, and daily functioning. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the reasons behind the difficulty controlling anger in BPD, how it manifests, and the impact it has on individuals with the disorder and their relationships. Understanding anger in BPD. For individuals with BPD, anger is not simply a reaction to frustration or external triggers, it is often a core emotional experience that feels overwhelming and difficult to control. The intense and frequent feelings of anger are often fueled by emotional dysregulation, a key feature of BPD that involves difficulty managing intense emotions. 1. Triggers for anger. Anger in BPD can be triggered by a wide range of events, but it is often tied to experiences of perceived rejection, abandonment, or disrespect. Even minor slights or miscommunications can trigger disproportionate emotional responses. Common triggers for anger in BPD include interpersonal conflicts, disagreements with friends, family members, or partners can lead to explosive anger, especially if the individual feels misunderstood or invalidated. Perceived abandonment, any situation that feels like a threat to the person's relationship, for example, a partner pulling away or a friend not responding promptly, can evoke rage or fear. Feeling invalidated or criticized, criticism or negative feedback, even if constructive, may be interpreted as an attack on the individual's worth or character, leading to feelings of intense anger. 2. Anger as a response to emotional pain. For many individuals with BPD, anger is a way to express emotional pain, fear, or vulnerability. Since emotional distress can often feel unbearable, individuals with BPD may use anger as a way to mask or avoid these deeper, more vulnerable emotions. This can be particularly true when they feel helpless or powerless in a situation. Defense mechanism. Anger can serve as a defense mechanism to protect against feelings of rejection or abandonment, which are major fears for people with BPD. The outward expression of anger may be an attempt to protect themselves from the emotional distress of being hurt or abandoned by others. Masking vulnerability. When someone with BPD feels emotionally overwhelmed, expressing anger can create a temporary feeling of control over their emotions, even though it does not address the underlying pain or fear. 3. Difficulty calming down. One of the most challenging aspects of anger in BPD is that individuals with the disorder often struggle to calm down once they have reached a high level of emotional intensity. Unlike individuals without BPD, who may be able to regain emotional composure after an argument or frustration, those with BPD may experience prolonged feelings of anger, shame, or frustration after an outburst. Persistent anger. After an episode of intense anger, the person with BPD may continue to ruminate on the event, replaying it over and over in their mind, which can lead to prolonged emotional distress. Difficulty regulating emotions. This ongoing emotional turmoil can make it challenging to return to a calm and balanced state, leading to a cycle of emotional instability. How anger manifests in BPD. The expression of anger in BPD can vary widely, but it often involves impulsive or extreme behaviors. These behaviors can be verbal or physical, depending on the intensity of the emotion and the situation. Common manifestations of anger in BPD include 1. Verbal outbursts. Individuals with BPD may experience intense verbal outbursts, such as shouting, name-calling, or accusing others of betrayal. These outbursts can happen suddenly, without warning, and may seem out of proportion to the situation at hand. Blaming others. The individual may direct their anger at others, accusing them of causing the emotional distress or triggering feelings of rejection or abandonment. Extreme language. The use of extreme language or exaggeration, such as saying "you never care about me" or "I can't stand you," is common when emotions are dysregulated. 2. Physical aggression. In some cases, The anger experienced by individuals with BPD can lead to physical aggression, such as hitting walls, throwing objects, or even physically striking others. While not all individuals with BPD engage in physical aggression, those who do may feel a temporary release of emotional tension, followed by guilt and shame. Self-destructive behavior. Some individuals with BPD may turn their anger inward, using self-harm as a way of expressing their emotional pain and frustration. Escalating violence. The risk of escalating from verbal anger to physical violence is higher in those with BPD, particularly if they feel trapped, unheard, or powerless in a situation. 3. Rapid shifts in emotional tone. Another manifestation of anger in BPD is the rapid shift from emotional highs to lows. Individuals may experience an emotional outburst followed by intense regret or self-criticism. This can be confusing for both the person with BPD and those around them, as the intensity of the emotions can seem inconsistent or unpredictable. Idealization devaluation cycle. As discussed in previous episodes, the cycle of idealization and devaluation in BPD can lead to quick emotional shifts. A person may initially feel that someone is perfect and then shift to anger and resentment when they feel betrayed or rejected. The impact of anger on relationships. The difficulty in controlling anger in BPD can lead to significant relationship problems. The intensity and unpredictability of emotional outbursts can cause strain on relationships with family, friends, and romantic partners. Some of the common relational impacts include: 1. Emotional turmoil for loved ones. Partners, family members, and friends may feel emotionally drained by the constant emotional shifts and outbursts. They may struggle to understand why the person with BPD reacts so intensely or why their emotions seem to shift so rapidly. This confusion can lead to frustration, resentment, and disconnection. 2. Fear of rejection or abandonment. The person with BPD may experience heightened fear of rejection or abandonment, which can be exacerbated by the anger they express. They may push people away when they need them most, leading to a vicious cycle of emotional conflict and relational instability. Their loved ones may distance themselves out of fear of the intensity of the emotional outbursts, which only deepens the person's fear of abandonment. 3. Difficulty maintaining stable relationships due to relationship instability. Individuals with BPD often experience frequent breakups, conflicts, and misunderstandings. These relational difficulties are tied to the unpredictable nature of anger and the inability to regulate emotions in a healthy way. Treatment for anger in BPD. Managing anger in BPD requires comprehensive treatment, which typically includes a combination of therapy, skills training, and sometimes medication. The primary goal is to help individuals develop better emotional regulation skills and to learn healthier ways of expressing and processing their emotions. 1. Dialectical behavior therapy, DBT. DBT is one of the most effective therapeutic approaches for managing anger and emotional dysregulation in BPD. DBT focuses on mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. It helps individuals with BPD become more aware of their emotions and responses, so they can better manage intense feelings like anger before they escalate into destructive behaviors. 2. Cognitive behavioral therapy, CBT. CBT helps individuals with BPD identify and challenge the negative thought patterns that contribute to anger and emotional instability. By addressing distorted beliefs and unhealthy coping mechanisms, CBT can help individuals learn healthier ways to cope with anger. 3. Mentalization-based therapy, MBT. MBT focuses on helping individuals with BPD understand their own emotions and those of others, enhancing their ability to empathize and regulate their emotional responses in relationships. This therapy helps to reduce reactivity and improve emotional insight. 4. Medication. While there is no specific medication for BPD, certain medications may be prescribed to help manage symptoms of anger, anxiety, or mood swings. Medications such as mood stabilizers or antidepressants can help reduce irritability and improve emotional regulation. Conclusion. Difficulty controlling anger is a core symptom of borderline personality disorder, BPD, and it can significantly impact an individual's relationships, self-esteem, and overall functioning. The intense and frequent anger experienced by individuals with BPD is often linked to emotional dysregulation, interpersonal struggles, and a deep fear of rejection or abandonment. Fortunately, therapies like DBT and CBT offer effective strategies for managing anger, improving emotional regulation, and fostering healthier relationships. In future episodes, we will continue to explore effective treatment strategies for BPD and how individuals can build skills to manage their emotions and lead more stable, fulfilling lives. Stay tuned for more insights into borderline personality disorder.